Welcome friends, I am Dr. V.K.Chauhan, homeopathic physician. Revise with me the homeopathic remedy Argentum nitricum. The common name is silver nitrate or lunar caustic. Formula is AgNO3. The remedy was proved by Dr. Henneman. This is the 23rd remedy on the roll of Allen's Keynote, and we are dealing with part 2, general overview in a classical format. This has got certain additions to Allen's Keynote, and this is best for BHMS students and interns. So in the first phase, if we are going to start with this, why should we go for classical format? The answer is that classical format is the best to study a remedy, as well as it is the best for therapeutic application. This background gives us a good information which is synthesized in a very systematic manner. So first, it fulfills the homeopathic case taking essentials, and these are given in aphorism 5, and aphorism 5 tells us useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of chronic disease, to enable him to discover his fundamental cause, which is generally due to a chronic miasm. In these investigations, the ascertainable physical constitution of the patient and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual functions, etc., are to be taken into consideration. The second point it fulfills is the Boenninghausen 7 points essential to complete the disease totality, which includes number 1, quiz, who. Quiz means who, and here it refers to the personality of the individual. Second point is quid, what. It tells us about the disease, its nature and peculiarity. Third point is ubi, where. It tells us about, or it demands, what is the seat of disease. Fourth point is cubus auxilis. Here we have to give the concomitant symptoms or accompanying symptoms. And fifth point, important point, is the cur. Why? Cause of the disease we need to find out. And sixth point is quamado, that is general modalities, aggravation and amelioration. Seventh point is quando, when. This is the time modality. And these are the informations which are very essential to complete the disease totality. And all these things are possible if we have the classical format, as it fulfills guidelines given in aphorism 5, which constitute the information is essential in every given case for achieving a cure. Boenninghausen 7 points to complete the picture. So first heading under classical format is the constitution, and it corresponds to point number 1 by Boenninghausen, that is quiz, personality of the individual, age and sex. So its somatic part gives us the idea about physical characteristics, age, sex, build. B part is psyche, which tells us about temperament and mental attitude and mind. Second heading is causation, and in causation we have diathesis, which is corresponding to the point 3, ubi, seat of the disease, where it is chronic disease, generally because of miasm, and if it is an acute disease, where we have the exciting cause is important, and that exciting cause is the point 5 given by Boenninghausen, that is cur, cause of disease. This is in relation to acute disease. And diathesis is in relation to miasms, especially in terms of the chronic disease. Now we come to the third point or third heading, that is the characteristic symptom, which tells us about the point 2 quid of Boenninghausen, disease, its nature and peculiarity. It includes characteristic physical generals, characteristics particular generals, and concomitant symptom. Here concomitant symptom is the fourth quibus auxilius accompanying symptoms of the Boenninghausen's. Fourth is the relationship. Here we find the remedy relationship, whether we have to give the similar remedy or you have to differentiate from the similar remedy, what are the antidote to the remedy, what are the remedies which are going to complete or follow up the main remedy which you are prescribing. So general modalities, we have Quando, which is the 6th point, which tells us about the general modalities, aggravation, amelioration, and 7th point, Quanto. Sorry, 6th point is Quamado, and 7th point is Quando, which is time modality, which is we have seen in aggravation and amelioration part. Now, from above information what we have gathered, we need to further synthesize, and we have to go for anamnesis, and anamnesis is to complete the following areas, and these are the information which we have to complete, that is predominant active miasm. In that particular phase, what is the uppermost layer which is presenting us, whether it is acute or it is chronic or acute episode in a chronic disease, that will be achieved through the above information. Remedy selection, and once we come to have the totality and miasmatic aspect, whether it is acute miasm or the chronic miasm, we will select appropriate remedy, whether it is intercurrent miasmatic remedy or it is a constitutional remedy or it is acute or subacute remedy. Then comes the potency selection, and you will have the above information for your selection of suitable potency, which is going to suit to this patient which is under your consideration. Now, from where we have got some information in this regard, if you find Allen's Keynote arranged and classified, rearranged and classified, this is the work which is been published by Jain Publishers, and it has been presented by Azad Rai from Ludhiana. The great work has been done, and every student which is following Allen's Keynote now reading this particular book, and it has the similar format. However, in this format there are certain drawbacks. What are the drawbacks in this book? It lacks the information about the source of medicine, preparation of medicine, prover, sphere of action. Causation is not given as a separate title. So your study remains still incomplete, though you are studying a classified information which we require to read. Here we will compensate that in this particular presentation. So general information which is not given in Allen's is number 1 slide here tells us about remedy profile. This is a polycrest constitutional, acute, subacute and chronic as well as deep acting remedy. The source, it is a chemical salt of nitrate of silver. The kingdom, it belongs to mineral kingdom. Preparation, the salt is triturated with sugar of milk to prepare third centesimal potency. The higher potencies are prepared with alcohol from third C onwards. The remedy was proved by Dr. Heinemann in 1815. It was a short proving. However, Dr. J. O. Muller proved it and published one of the most learned treatises in the medical literature in 1845. It was an extensive proving. It was published in Austrian Journal, and you have to see volume 2, 1846, page 12112. This reference is from Guiding Symptoms of Our Materia Medica by Hering. Now we come to the organ tissue affinity or sphere of action. It is central nervous system, peripheral nervous system, PNS is wrong. Read it. Peripheral nervous system, PNS. Mind, cerebrospinal nerves, spinal nerves and cranial nerves, mucous membrane of stomach, bowels, eyes, throat, urethra, periosteum and skin. Let us go to the review of Allen's Keynote with add-on information in classical format now. Number 1 is the constitution, soma, physical aspect. Always think about Argentum nitricum on seeing withered, dried up, old-looking patient, thin, scrawny, in cecal car, PQR second, what we have seen, emaciation progressive every year, most remarkable or most marked in the lower extremities. We have similar remedies, ammonium mure, where marasmus you can find, but marasmus is in children's. But elderly who is losing weight, emaciated elderly person is cachectic. Young widows, they furnish the very suitable ground to have certain developments which belongs to the symptomatology of Argentum nitricum. Side affinity you will find is the left lateral affinity. It is, you will find in third 3+ symptom, generalities, side left in Kent repertory. Thermal affinity is the patient is chilly. You can also confirm this particular symptom. It is second grade remedy under generalities in Kent repertory. The psyche part of constitution is the temperament, and Argentum nitricum is nervous, anxious, apprehensive person. Mentally, apprehension when ready for church or opera, diarrhea sets in. It is similar to gelsemium. Time passes slowly, similar to cannabis indica. Impulsive, wants to do things in hurry, must walk fast, is always hurried, anxious, irritable, nervous. This is under mental generals. You will find dreams, which is not given in Allen's Keynote, and you will find snakes given under Kent repertory, 2+ symptom. Desires, craves sugar, child is fond of it, but diarrhea results from eating. Craves salt or smoked meat, calcarea fos, we have comparable remedy. This is PQR 8. If you refer to the Kent repertory again, you will find salty things also desired by Argentum nitricum. It is a 3+ symptom in Kent repertory. Cold drinks, cold food, fruit, sour, acids are given under 2+ in Kent repertory. Aversion, we don't have any good information for that. Now we come to the second point, which is causation. And in causation, we are talking about diathesis. And here, Allen tells us it is good for acute or chronic diseases, which are precipitated or caused by unusual or long continued mental exertion. So it is good for acute diseases which are brought on by anxiety, and chronic stressors will bring about the chronic miasmatic disease, which will have their miasmatic modalities to confer upon that particular distinction. Now, for acute elements from is diarrhea resulting from eating sugar, coffee increases nervous headache, voice complaints after using tobacco. We have PQR 18. Now let us go to the characteristic generals. Chilly when uncovered, yet feels smothered if wrapped up, craves fresh air. Great longing for fresh air. We have similar remedies, amyl nitrate, pulsatilla and sulfur. Convulsions preceded by great restlessness. This is PQR 16. Now we are dealing with characteristic particulars now. These are the complaints for which the patient usually seeks your consultation. Here, the first symptom which we are getting is the headache, congestive with fullness and heaviness, with sense of expansion, habitual gastric of literary men from dancing, hemicrania, pressive screwing in frontal eminence or temple, ending in bilious vomiting, worse from any exhaustive mental labor, and better by pressure or tight bandage. We have similar remedies to compare is Epis and Pulsatilla. Here, hemicrania is migraine and classical migraine where we have bilious vomiting, and generally vomiting provides relief. Literary man means the sedentary people, and sedentary people who lack their physical exertion, physical activity, and then what happens, their GIT movement becomes sluggish, and GIT disturbances can cause headache also and fullness. Now let us go to the second symptom, which is acute granular conjunctivitis. It is a scarlet red, like raw beef, discharge profuse, which is mucopurulent. Ophthalmia neonatorum is profuse, purulent discharge, cornea opaque, ulceration, lids are sore, thick, swollen, agglutinated in the morning. We have to compare between Epis, Merksol and Rustox. Eye strain from seeing, which is worse in the warm room, better in open air. We have similar remedies where we have to compare Natramur and Ruta. Diseases due to defective accommodation, where ciliary muscles are under strain. Ruta is also one of the very good remedies for that. Chronic laryngitis of singers. The high note causes cough. Sensation of a splinter in the throat when swallowing. We have Dolichos, Hipersulf, nitric acid, Silesia. Similar remedies. In or about uterus when walking or riding. So this is a PQR symptom, characteristic symptom of this remedy. Coition painful in both sexes, followed by bleeding from vagina. We have nitric acid, closely competing remedy. Metorrhagia, especially in widows, young widows who have emotional trauma and that disturbs their hypothalamic pituitary axis and causes disturbances. Emotional brain is affected. Emotional brain directly affects the hypothalamus. Hypothalamus, which controls the pituitary, gets defunct, and ultimately hormonal disturbances in young widow causes metorrhagia. We find this remedy is good in sterility and especially in cases of menopausal age group where perimenopausal patient having nervous erethism at the change of life, we have to have comparison with lachesis. The next is the great weakness of lower extremities with trembling, cannot walk with eyes closed, like Illumina, walks and stands unsteadily, especially when he thinks himself unobserved. It means if you think that if the people are observing him and he is conscious about it and that he stumbles upon, so it can be a functional disorder. But if he, in a private place where nobody is observing him, tries to stand and he becomes unsteady, incoordinated, stumbles upon, it means he has some sort of organic disease. He is not feigning. He is not building up symptoms. And if at all this happens, it points towards the sensory ataxia. Sensory ataxia generally you will find with subacute combined degeneration. In old times, it was commonly because of tabes dorsalis. Now it is commonly seen because of diabetic peripheral neuropathy, and autoimmune disorder, multiple sclerosis can be one of the important causes. So you need to take the case and investigate and confirm the pathology. Now the next characteristic particular is belching accompanied most gastric ailments, flatulent dyspepsia, belching after every meal, stomach as it would burst with wind, belching difficult, finally air rushes out with great violence. We have diarrhea, which is having green mucus like chopped spinach in flakes, turning green after remaining on diaper, after drinking, after eating candy or sugar, masses of mucolymph in shreddy strips or lumps, with much noisy flutters, diarrhea as soon as he drinks. So please, we have comparison at each particular point: asaram, arsenic, crotontig, trombadium. So these are the medicine needs to be evaluated and compared. Urine passes unconsciously day and night. If it is because of the neuropathy, peripheral neuropathy, which is supplying to the bladder, the remedy is causticum. But if it is because of spinal cord involvement, like what I was talking about, then probably argentum nitricum is the remedy. Impotence. Erection fails when coition is attempted. Agnus, caladium, selenium. Here impotence is anxiety. Because of anxiety, there is a performance anxiety, and that may cause this kind of a symptom. But please remember, if it is because of involvement of the spinal cord, you will come to know on investigation if spinal cord is involved or not. Now we come to the relationship, the fourth point in classical format. Here we find the netremur for the bad effects of cauterizing with nitrate of silver. Coffee increases nervous headache. Boys complaints after using tobacco. And it is similar to netremur, nitric acid, lachesis, aurum and cuprum. After Vereliana, lycopodium follows well in flatulent dyspepsia. General modalities where you will find aggravation: cold food, cold air, eating sugar, ice cream, unusual mental exertion, and the patient is better by open air, craves, the wind blowing on his face, bathing with cold water. Let us go to the miasmatic orientation or miasmatic understanding on the above symptoms. So what are the miasmatic markers we have available on the above text? If the anxiety is neurotic anxiety, it means the patient is predominantly psoric. If there is a history of gonorrhea, whether it is acquired while taking birth, in case of neonate, in the vagina, infection occurs, or you acquire it sexually transmitted disease, it points to psychotic trait. And if you have the symptoms where there are ulcerations, ataxic gait, where we find that central nervous system, especially the spinal cord, is affected or degenerated, we are facing the symptoms which are pointing to syphilitic trait. So our impression on the above basis is that argentum nitricum is a trimiasmatic remedy, and presenting symptom will decide or point to the predominant miasm at that particular point. So let us go to the posology. So doses. The best is the lower potencies as advised by Dr. Clark. Higher and highest potencies are recommended by Dr. Kent. The 200 or 1000 potency in watery solution as a topical application in ophthalmia neonatorum has relieved when the crude silver nitrate failed, has been advised by Ellen. We talk about repetition of the remedy, may be repeated when symptoms call for it, and duration of action is about 30 days according to Clark. Now the clinical condition where we are going to use this medicine commonly is premature old age or emaciated person or child who is having marasmus, social anxiety disorder, erectile dysfunction, climactic complaints or perimenopausal patient, hoarseness, laryngitis, especially speakers or singers laryngitis, ataxia, flatulence, brain fag, GERD or peptic ulcer, gastroesophageal reflux diseases are commonly covered by this particular remedy. Thanks. Thank you very much for your patient listening. Please